Let's talk about HIV.
Let's talk.
HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body immune system, making it harder to fight off infections.
But here's the good news. With today's medicine, HIV is treatable, preventable, and manageable.
Knowing your status and taking control of your health is the most powerful step you can take. Let's talk more about it.
Delta Sigma Theta Sorority Incorporated remains committed to global health equity, and one of our central areas of international awareness and involvement is supporting research that advances HIV/AIDS prevention and treatment. Around the world, communities continue to face significant challenges: stigma, limited access to care, and resource shortages all contribute to higher infection rates and delayed treatment. Through our service initiatives, we uplift organizations dedicated to scientific research, public health education, and equitable care delivery. When we contribute to HIV and AIDS research, we are not only funding innovation, we are helping save lives. As Delta women, our advocacy ensures that families and communities worldwide have a future where prevention, treatment, and dignity are universally accessible.
Here's the reality. HIV disproportionately impacts the Black community. Social and economic factors like access to health care, stigma, and systematic inequalities play a big role. But this is not the end of the story. By raising awareness, breaking stigma, and supporting each other, we can change the narrative.
In Michigan, HIV continues to have a disproportionate impact on the Black communities.
The majority of new HIV diagnoses among men in Michigan are among Black men, especially those under 40. Black women also face a disproportionate burden. While women overall account for fewer newer diagnoses than men, Black women represent the majority of female HIV cases in Michigan.
HIV is just not a medical issue, it's a social justice issue. Factors like access to healthcare, stigma, and systematic inequities all contribute to these disparities. But here's the empowering truth. Testing, PrEP, and treatment work. By knowing your status, starting PrEP if you're HIV negative, and getting into care if you're HIV positive, we can change these numbers and protect our communities.
HIV can be passed through certain body fluids, but there are proven ways to protect yourself. One of the most important tools is PrEP, pre-exposure prophylaxis. PrEP is a daily pill or shot that can reduce your risk of getting HIV by up to 99%. It's safe, effective, and available to anyone who wants to take charge of their health.
Many communities of color face barriers to accessing PrEP despite being disproportionately affected by HIV. Increasing PrEP uptake in our areas is critical to reducing new infections. If you're HIV negative, talk to a provider about whether PrEP could support your sexual health and empower your well-being.
The only way to know your HIV status is to get tested. Knowing your status gives you powerful information to keep you and your partner or partners healthy. There's many options for quick, free, and painless HIV testing.
If your test result is positive, you can take medicine to treat HIV to help you live a long, healthy life and protect others. If your test result is negative, you can take actions to prevent HIV.
Know your status. Getting tested is quick, easy, and confidential.
Get into care. If you're living with HIV, treatment can help you reach viral suppression, meaning the virus is undetectable and untransmittable.
Learn about your options like PrEP and PEP if you are HIV negative.
Spread the word. Share this knowledge with your friends, family, and community. Together, we can build a future where HIV is no longer a threat.
HIV doesn't define you. Your health, your choices, and your future are in your hands.
Whether it's getting tested, starting PrEP, or staying in care, every step you take is a step toward empowerment.
Let's stand together. break the stigma and take control of our health. The time is now.
As a board-certified family nurse practitioner, I often see how sexual health, including HIV testing and prevention services, can be overlooked in routine healthcare. While conversations with your medical provider about your family's medical history or new health concerns you may be experiencing are very important, talking about sexual health is just as critical. Many people don't realize that sexually transmitted infections, also known as STIs, including HIV, are common, often have no symptoms, and can lead to serious health issues if they go unidentified. Untreated HIV and other STIs can have serious health consequences for both men and women, including infertility, chronic pain, pregnancy complications, increased risk of other infections, and long-term damage to the immune and reproductive health systems. That's why regular routine testing matters. You may consider getting tested if you have a new sexual partner, if your partner has other partners, if condoms are not used during every sexual encounter, or if you're experiencing symptoms that are of concern to you. Knowing your HIV and STI status allows you to receive treatment early, protect your health, and help prevent the spread of infections to others. When it comes to HIV, getting tested provides an opportune time to discuss prevention options like PrEP with your medical provider. It's important to remember that HIV does not discriminate. It doesn't know your age, race, sexual orientation, or background. It's often said that anyone can be HIV possible. Taking charge of your sexual health is empowering. Getting tested, asking questions, and learning about prevention options helps you to make informed choices for yourself and your future. Never be afraid to discuss your sexual health or HIV and STI testing needs with your medical provider.
I'm not only a person, I am a Black woman who is living and thriving with HIV. I am here to say we are all HIV possible. Let's talk about U equals U. Undetectable equals untransmittable. A term that has saved everyone's life that is living with HIV. As long as you have been virally suppressed for 6 months or longer, you cannot transmit the virus. That is what U equals U mean. And that statement there gave me the freedom to be able to live and thrive and be happy while diagnosed with HIV. Getting tested and into care if you are positive is the most important thing you can do for your health. Not only to save your life, but others also. We can eradicate HIV together through comprehensive prevention, care, and treatment.
Today and every day, we affirm this truth. You matter, your health matters, your story matters.
Whether you are living with HIV,
supporting a loved one, or working hard toward community health.
Research shows that social support, empowerment, and belonging significantly improves health outcomes.
You are not defined by diagnosis or by stigma.
You are defined by your strength, your resilience, and your ability to move forward with hope.
Together, we are building a healthier, more compassionate future. And together, we will continue to rise.